So when I was in nursing school, I loved everything. Every semester I went through, I loved med-surg, I loved emergency, I loved critical care, I loved neuro, and I couldn't decide which department would be best for me. And it was suggested to me that I try the float team, and I got really excited about the idea that I could float and work in every department.
When I started, I didn't really know what I wanted to do. I used float as kind of a way to figure that out, and here I am 7 years later, still not really knowing what I love the most.
You get to see new things every day, you get to experience new things every day, and you're working with all your coworkers across the hospital, not just one unit, not just one small team.
What attracted me to work here at Community Medical Centers is that it's such a great organization, and we serve different types of patients, different types of cultures.
Just seeing a different variety of patients, like that specialty. Because when I was in tele, I was just with tele. Being with the float, I get to go to ED, go to ICU, step down.
After our shifts, we come together and we talk to each other. It's kind of like a little debrief. And before our shifts, we do have our huddle. And even though for 12 hours we don't see each other, we still remember that we're all here for each other.
We have about 240 staff members on the float team. We float to Community Regional Medical Center. This is our home base. We also float to Clovis Community and to Fresno Heart, wherever the need is. We have RNs, LVNs, monitor techs, PCAs, patient observers, and externs.
They love each other, they help each other, and they support each other.
Every day I see a lot of different everything. You're just hanging out with grandma on the med-surg floor because she fell and broke her hip, so you really see a wider variety, and you meet a lot of different and interesting people.
If you want to join the float team, be prepared to feel supported by your team. It can be a lot, but it's very rewarding. The float team is accepting with open arms.
A lot of people do ask me, how do you do it? There's really no answer to it. I kind of you just go with the float.
You know that you're supported. They really focus on having a work-life balance.
Coming to the float team, I think the perfect candidate would be that one that wants to learn, that wants to grow, and that is ready to face challenges.
As now being with the float team and being centralized, that I get to float to Clovis, I get to see people here at Clovis, and then go to CRMC or Fresno Heart, that you have just seeing people and seeing the faces of the patients that you will take care of.
If you're looking to grow your knowledge of what the hospital has to offer, we offer a lot of different things. We have neuroscience, we have cardiovascular, we have burn unit, and so you won't know until you try it.
The float team really feels like a family, and I love being a part of the community family. I can't imagine being anywhere else. I've been here for 8 years, and this is where I plan to retire.